Hello, everybody. Hello, everybody. You are welcome. You are welcome to Growth with Joyce. You are welcome. You are welcome. You are welcome to Growth with Joyce. You are welcome. Pure Gospel, you are welcome. How are you? How are we doing? Nice to see you too. So how is the weather over there? It's very warm here. The UK, it is very warm. How are you doing in terms of your work? Okay, it is cool. Work is great. That's good. Good to know that. Yeah, work is good. Yeah, work is good too. Hello, Miracle. Good to see you. How's work? Welcome. Welcome, Miracle. Good to see you. How have we been? Miracle, how are you? Okay. Thank you. How's work, Miracle? Okay. Good to know that. Good to hear that. All right. Anyone celebrating their birthday today? So that we can sing happy birthday to the person. Any happy birthday today? You're welcome. Thank you so much. Thank you so much for all your support. All your support so far. Thank you. Thank you, thank you, thank you. Please share the video, share the link. Share the link. Like, comments. Thank you so much. All right. Thank you so much. I just want to find out what topic would you guys like us to share on our next show, next topic. Ivan, good to have you here. Thanks, Ivan. Please share, please like, Please invite other people. Thank you. How's work, Ivan? How are you doing? What topic would you like to see? What topic do you guys want us to discuss on our next show? And also, if you have any topic that you want us to discuss, we can put that in the comment section here. Then you can go to our YouTube community as well and leave it there. And also, if you have any question regarding our topics, our videos, our live videos, our recorded videos, you can leave that in our community page, in our YouTube space. We need more engagement there. If you have any question, you want to bring a topic, whatever, you let us know. All right. So, welcome to Growth with Joyce. We the future, confidence in action. So, thank you all for joining. Thank you so much for your support. We appreciate a lot. So, our topic today is integrating patients who are navigating mental health challenges into the society. If I may ask, how to handle a violent patient? That's a good one. That's one of my field. That's my core field. How to manage patients who are presenting with, so that's how I'm going to construct it for you, who are presenting with aggression and violence. That's my main department. I specialize in that. So that's my specialty. So I'm happy to do that topic, even when I'm sleeping, I can deal with that topic. So, because that's my specialty. All right, so let's crack on. All right. Can anyone tell me how or if they have anyone who they have ever supported in the community? Leave a comment. If you've ever supported anybody and how you supported them, the interventions, the things you put in place in supporting that patient, supporting that person, that individual, leave in the comment section. Or if you've ever heard that, oh, so and so person is navigating mental health challenges in the community and how that person was supported. Leave a tip. You can make a comment. Thank you. So supporting people who are navigating mental health challenges to become fully included in the community isn't just about service. It's not about belonging. It's not about dignity and participation. This strongest system combines clinical care, social support, and everyday community life so that people can live, work, and connect on their own. There are so many things we have to do as a person, as a friend, as a community, as a family member when we know or have somebody who are going through mental health challenges. How do we support them? How do we integrate them into the community? Because sometimes people look at them as if they are flies. You are eating and you are trying to drive away flies. That's how some people perceive them. But the truth is, anybody, anyone, anybody, anyone, anybody, I'm underlining that, can become mentally unwell. Anyone. It doesn't have to be biological. That means it doesn't have to run in your family. You don't have to smoke or drink or do any of those things. Just a little stress can trigger it. Just a little malfunction of your body can trigger it. So when we see these people in the community, or if we know them or we are friends and families with them, We don't have to treat some people, not all, treat them as flies. Oh, no, this person, oh. I live with them every week, every day of my life. I live with them. I mean, I work, I provide care, so I will navigate that challenges with them. So that's one of the tips, some of the tips I'll give you today. Hopefully, it will change our mindset, the way we see them, the way we see our family members, friends, and the communities that are navigating mental health challenges. Core principle: integrating happens in the community, not in clinics. When people are unwell, they are in the hospital, they are just receiving treatment. But the integrating starts in the community. But the way we do it, or mostly all hospitals, what they do before the patient leaves, the patient is going to have somebody that will be supporting them in the community. Family members has a lot to play. Friends, they have a lot to play. The community at large have a lot to play. Then those that are being placed, they place patients in a professional's care. We have a lot to play as well. So the whole thing starts in the community, in the hospital. How are we going to care for this person? What are we going to do? And all that. But the main players, there are those in the community, me and you. We are the main players. We are the only one that can make them comfortable. We are the only one that can make them human. We are the only one that can give them that quick recovery that they need. And Express, you are welcome. Good to have you here. So when support is embedded in ordinary environments, neighborhoods, workplace, schools, faith groups, libraries, gyms, and social spaces, clinical care is essential, but it's only one part of a much bigger ecosystem. The clinical care, what I do, I go to work, we look after them, give them medication, spend time with them, and we leave them. But the bigger picture happens in the community. And it starts from me and you, how we perceive them, how we look after them, how we care for them. Because it can happen to anyone, just like I've said, anybody, anyone. But we all hope and try to say, oh, never, never, it's not me. If you count 5 families, if you do a, a survey, just 5, among the 5, there will be 1 family or 2 that somebody in that line is going through mental health challenges, because people don't speak out, people don't say anything. Once some of them, when their family members are having those symptoms, they try to hide it, or when they're back, they try to hide it. That is even more dangerous for them, because they need to integrate like every other person. It's just like you go to a general hospital, you had a leg cut, you have some wound, you have some illnesses you've gone to treat. It's the same thing. We should always show them love and respect. Yes, love and respect, kindness. You see them, you talk to them, you chat with them just like you would chat with me. It's the same thing. Sometimes when they are talking, we have what they call thought disorder. That means the things that they are saying is not aligning. You still pay attention. You just listen to them, what they are saying. And from what they are saying, you will pick 1 or 2 things. You pick 1 or 2 things. Yeah, so let's ride on. The 5 pillars of effective community integration. Community-based mental health teams. Before a patient is discharged from the hospital, they have what they call community-based health team in all over the world. It might not be as effective in some countries, but they have them. They are in the community. What they do is that there can be like nurses, they have doctors, they have social workers, they have is a complete team, OT, support workers, auxiliary nurse. So what this team does is for them to help support these patients. So when they are at home, they can call them. Maybe it's just for them to go shopping, for them to go do some cleaning, for other social networks. Some of them, even when they come out, sometimes it might be difficult for them to go to different places. You can support them, you can escort them, and stay with them just to see and provide that support. You can administer their medications as well. You can, that's if you're a nurse or doctor, you administer medications, and also you can integrate them if they want to work or if they are working before. You have to look for ways to see how you can support them for them to go back to work. Some are able to do it straight away, but some people cannot. It all depends on the extent of their illness. So this reduces hospital admissions and builds trust, because sometimes it's not good for patients each time, or somebody that is not well, that's having mental health challenges, just to be going to hospital for admission. It will make them to be institutionalized. So if we don't try and break that circle, each time hospital, if there are we know there are risk and they assess them, there are risk, they can go to the hospital and get some treatment. But when there are no major risks, it's good for them to be supported in the community. So when they are supported in the community, it is for us who are able to provide that support, to give them that support. So apart from nurses, doctors, support workers, auxiliary nurse, friends has to give them that support. Family has to give them that support. Religious center, what name it, everybody, schools have to give them that support. If they have to go back to school, they have to provide that support for them. So it's very important that this community-based, apart from the multidisciplinarity in the professionals, other people has to give that support as well. Even doing it voluntarily, you can decide to say, let me go and spend time with these people. So you can do that. And also the way to integrate them, they have to have a place to live. Imagine when one does not have a place to rest their head. It disorganizes you. It disorganizes them a lot. So it's either they have to stay with their family member if they can cope, or they can stay in a supported housing where they can start from there and start integrating, start mingling in the society. Thank you. Any questions so far? Thank you. Let's share. Let's share. Let's share the link. Yeah, thank you so much. So stable housing is the foundation for recovery. It is. So somebody doesn't have a place to lay their head. It's a big problem. So before they leave the hospital, they must have a place to go to. They must have a place to go to so that they can rest their heads. They need that rest. Employment and education pathways. Sometimes we hear this adage, or people say it and say, the idle mind is the devil's workshop. It is. When you don't occupy your mind, as a human being, you need to occupy your mind. You need to get your hands occupied. So when your mind is occupied, not 24 hours, you have to do things in between. You tend to start thinking about a lot of stuff. When you get your hands doing something, you occupy your mind. If I go to work, as soon as I get to work, what I'm thinking of is just that work. Provide care for my patient. Then when I'm on break, I can go and call whoever I want to call. I can interact or anything. So if I'm at work, I concentrate on that. So my mind is occupied at that time. I won't have time to start thinking about this or that and that. I will just concentrate on my work and make sure I do it effectively. Pure gospel, keep yourself usually busy. Yes, you rest in between, but your mind, you have to. If you need to rest, you rest, but keep yourself busy. It helps. So when we have patients, there are some patients who are lawyers, doctors, nurses, name it, professionals who are unwell. When they are unwell, they need to get back to work. They need to start treating patients again. They need to start being a teacher. They need to start being whatever profession. You need to integrate them again. So it's very important that we support them, because sometimes if they don't get this support, their career just dies, especially if their illness was caused by that career. So we have to provide that support. Work is one of the strongest predictors of long-term recovery. It is. This helps people find competitive jobs quickly. Peer support, which we have mentioned. Peer support. Supporting each other is so important. It's so important. It's a social network. No man is an island. No man can live on their own. You have introverts, yes. You have people who are not that socializing, yes. But they still want social connection or the other. There are things that they like. So peer support network is so important. People with lived experience provide emotional support. So when we say lived experience, we mean somebody who has who has suffered from mental health disorder before and is no longer having those issues. They have experience. They can support others who are navigating it. We call them expert patients. They know more than us what it means, the things that they can use to support themselves, they know it. And if they have somebody who is going through the same situation, they are able to provide that care. So the lived experience provide emotional support, advocacy, and hope. They will tell the person, oh, they have gone through this before. You can do it. That alone, it goes a long way. Even no man is an island. Yes, you can't. That's why you have doctor, lawyer, this, that, different professions. It is for us to integrate. It's for us to support each other. If I'm unwell, I need to go and see a doctor. I need to see a nurse. If a doctor is unwell, he needs to go and see another doctor. He cannot prescribe any medication for his or herself, whereas he's a doctor. He will understand the symptoms that is going on, but he can only buy off the counter. If something that he needs to see a doctor, he has to go and see a doctor. So it's the same thing. If we have legal issues, we go and see a lawyer. So we have to mingle. It's the same thing. We have to integrate people who are navigating mental health challenges in the community. It is my duty. It is your duty. It is our duty to do it. Peer workers reduces stigma and help others navigate service more confidently. Stigma is the biggest problem. It's, this person, I don't want to mingle. But they forget that the brain is so fragile. The mind is so fragile. It is so fragile. Over the years, I've come to understand this and say, oh, because when I see the people that I look after, sometimes I will say, how did it happen? Did they eat fruit? Did they not eat fruit and veg? Or did they not exercise? Or did they not sleep? Or is it, you will see people, name it, whether they are from Cambridge, Oxford, name it, any kind of person, any professional, name it. Sometimes you see a lot of people, they don't come to hospital for admission. They have mental health disorders, illnesses, but they are able to know their triggers. So they maintain themselves. You wouldn't know. They live like me and you. They live like me and you. It's just that some people, can cope more than others. Pure gospel, but I also know that prayer has a major role to play also in the mental health environment. Yes, if you believe. The Bible says, whosoever, whosoever call on the name of Jesus shall be saved. But you have to believe in it. Whosoever, a Christian, a Muslim, a pagan, anybody, if you believe. So in the aspect of religion, if somebody believes, yeah. So it all depends. It all depends. All right. Thank you for that. Let's like, let's share. That's correct. So, social connection and community assets. Sports clubs, libraries, art groups. These are the ways to integrate them. Faith, what you have just said now, pure gospel, say faith communities, volunteering, and local charities all create belongings. We all create belongings. This is where people rebuild identity and confidence. The religion, in the aspect of religion, people believe, who are we actually preaching to? Who are we actually telling about the word? People believe that it is people who actually need this help. So these are the people we need to welcome in our faith centers. We can go and volunteer for them. Local charities. These are all the ways that we can make them to belong. So there are practical strategies communities can implement now. Co-production with service users. People with lived experience help design services, making them more humane and effective. So when we have people who have navigated mental health challenges before, they can design, they can tell hospitals and say this is how they think these things can work because they have gone through it before. So these are ways to integrate them. Chukwuemeka, good to have you. Chukwuka, Ernest, it's usually my first time joining your live show. I have only seen watching your videos and listening to your teachings, ma. And I must say they are really great and inspiring. Thank you so much. Thank you. Thank you so much. I appreciate. Thank you for joining. We have so many good stuff here. You are free to suggest a topic. This is a free space, a safe space to express yourself. Thank you so much. Thank you. So NS Praise invited you, shared it. Thank you. Thank you. So people with lived experience can design the services because people always say somebody who's gone through situation has more experience. It's true. They might not have more of the professionalism side, but in terms of them, other stuff like the things that worked for them, they are able to support others also to integrate into the community because they are able to say, this is what can make me how I integrated, this is what helped me, and this is what helped me. I think if you implement it, it will work. Any questions so far? All right, pure gospel. Man, someone said that they don't need a silent gathering. Book club. Okay. Yeah, there are book clubs. Yeah, you can use that as well to integrate them. Trauma-informed environments. Sometimes they have what they call trauma-informed training. I do some of those trainings as well. The reason is so that I'll be able to care for patients who have navigated traumas, who are going through some kind of traumas. So I do attend such training. So staff and volunteers understand how trauma effectively affects behavior and communication. Definitely. There are some things that might happen. Let's say, for instance, I saw somebody fighting, and Ivan saw somebody fighting. And during the fight, Ivan might be fine with it the way things went. And me, I will not be fine with it. I will start picking everything that has happened. With that, it will make me to be traumatized and say, how can this happen? So sometimes the way when people go through situations, the way it comes back as trauma for them, it differs. It differs with individual. Some people can handle some situation. Some people just cannot. Some people just cannot. So we have to support them to be able to integrate them. Sometimes you say, is it not that small thing? It's not small thing. It's not a little thing. It's not a little thing for some people, especially if it's something that has happened before and is reoccurring. It is a trauma. So we have to support them. We have to integrate them. Don't just dismiss them like that. No. Because the things that you think is a little thing for somebody is a big thing. The person might live with that trauma for the rest of his or her life. You might be thinking the person is just, being a babyish. No, it's not. So if we try to understand people's trauma, it will help us to integrate them in the community. Any questions so far? Any question? All right. So one of the ways is anti-stigma campaign. Is for us to stand for these people. Is for us to make people understand that people feel stuff differently. People behave towards a situation differently. People think differently. People do things differently. People handle stuff differently. So they have to understand if this person is going through trauma, there is a reason for it. His makeup is not my makeup. Twins, even twins, they do things, most of them do things differently. Most of the things they do differently. Sometimes they can be identical and it's different. Their makeup will be different. Ivan, it is so true and true. Thank you. So anti-stigma is one of the way for us to integrate them. Community events, storytelling, and visible advocacy. Integrating them. So even your doctors, our doctors, the general practitioners, it is also good for them to understand these things so that when their patient comes to them, they will be able to support them. So the hospitals, apart from the mental health settings, this is part of the things they need to be doing. If they know their patient is going through trauma, bereavement, it's like bereavement. It's like divorce. Some children, their parents will divorce when they are 1 year old and they'll be fine. Some, even the ones that they've lived with their parent 20 years and the parent dare to divorce, I'll put the dare to divorce. It will live with them for the rest of their lives. Or if there is bereavement and it was not properly handled. Some children, they will just go on with it. Some families go on with it, but some children, every time they are thinking of their dad, every time they are thinking of their mom, every time they are thinking of their sister. So individual differences, how they can handle stuff. That's what we as a community, we as a society, we have to understand that. How to integrate them, how to make people settle in the community, how to make them happier, how to make them live like every other people, how to make them feel they are not different. They are not. Most of them, they are the people that suffers from bipolar. the mood swing, the mood behavior. They are the most intelligent people. They are very high intellect. They are the most intelligent. They are very smart. Intellect is there. They are extremely intelligent. Those people that suffer from bipolar most times, that has this high mood and all that, they are well read. They are the top people. So go and check it out. But sometimes they fall sick. They become mentally unwell. So, any question? NS praise. Divorce in Nigeria affect most children, but divorce outside, they are very okay with it. Outside, do you mean outside the country? It's worse here. If you say that, all over the world, if we check the statistics, one, it all depends on the relationship they have, the children, the husband, the wife, the relationship they have at home. That is where divorce start affecting children or affecting either the man or the woman. It all depends on the relationship. Some people with divorce, they will say, thank God, the divorce has ended. But majority is all over. Divorce, bereavement, those two, especially if it's a blended family. You know what's called a blended family? You have Mr. A and Mr. B. They've remarried. This one has children, and the partners, husband and wife, they are still alive. Or this other side, one is still alive or whatever, or there is widow or widower. Then you now get married, blended family. You know what's a blended? That's it. You get married. You have your own children. You have your stepchildren from this side, paternal, maternal, paternal, maternal. Can you see the blends? So marriage is a big one. Relationship is a big one. All right, so let's crack on. Why are they very intelligent people normally have mental? There are people that always most time, they want to aim high. So they tend not to, in a way, they tend to forget that these things can trigger them. If they want to read, to have a PhD. They want to have the doctorates. If they are doctors, they want to be consultant. So there are people mostly that aim I. And most time they don't try to listen to their triggers. That is, their body is telling them, go and rest. They don't want to rest. They want to study the next study. They want to aim high. So, but sometimes what they do, if they know that they are prone to it, they put system in place, especially if they are no longer reading. But the business people, because business people, they put things in place, like they put system in place. They have people who are looking, they have managers, they have this, they have that. So they tend not to take most of the stress. So that's it. When they don't recognize that they are getting stressed, so they just get stressed. I've seen somebody who said that he's going to be a millionaire between the age of 20 to 30. He said he's going to be a millionaire. So the person became a millionaire. He's in Forbes. He's in everywhere. A young chap. So I saw this person. I met with this person. And I said, how did you do it? He said, because I said I'm going to do it. He said, especially, I promised myself I'm going to do it. He's a millionaire in pounds. He became unwell. So he did not watch his triggers. He started from being stressed. He was stressed and he did not recognize that. That's how he became unwell. He's still rich till today, but they have to put system in place for him now, because that's the only way he can manage. So that's the reason. When you are pursuing stuff, you have to know Ah, I'm tired. Oh, I have to rest. So some people don't know how to control that. Then some people, it's in their line, their bloodline. And if they don't take time to recognize that, they will be affected along the line. Some people don't have it at all. But because of the continuous stress, they're stressing themselves a lot in terms of the mental aspect, they can become unwell. So crisis alternatives. What makes integration succeed? Belonging matters more than treatment. Like we said, integrate them, support them. People recover faster when they feel part of something. When they come to our faith center, we have to make them comfortable. When we see them, we have to make them belong. So all these things makes them get better. But when we start feeling, oh, there are flies, I need to drive them away from my food. Oh, I can't eat this food. I need to, no. So when you make them feel comfortable in the community, you respect them, you treat them just like you treat yourself. Show them kindness, love. They will get better. Sometimes 10 years you will not see them in hospital. Sometimes doctors can even wean them off their medications. That's the way. We have to make them belong. We have to make them feel it's normal. And actually it's normal. Because we are humans. It's not being religious. So, oh, because the person is a Christian, Muslim. No. Any other person, we have to treat them that way. That is how it's supposed to be. Small local familiar space, peer support, we have said that is impactful and professional care. Employment is therapeutic. Sometimes some people don't want to employ them. They will say, oh, I don't want this kind of person. They will make an impact. They can start with little stuff. They can help you with stuff. We have people who are disabled. They can do stuff. You can never be disabled in every aspect. Just like you have children that suffers from autism, all those stuff. Those children, you need to test their knowledge. They are so very intelligent. Very, very intelligent. Because they work in a form of repetitive way. When you teach them something, teach them, that's it. It stays there. Employment is therapeutic. Work provides structure for them, identity and social connections. It's very important. Stigma is the biggest barrier, not symptoms, not diagnosis. Stigma is the biggest barrier. Oh, no. I just want you to, if you check 5 families, you will see somebody there that is navigating. But sometimes those families, they provide good care for them. They support them. They take them out. They do everything with them. They are humans. A simple, actionable model. Stigma is the biggest challenge. It is. But we have to be anti-stigma. We have to break it. We have to integrate them. We forget that this is our generation now. We have other generation coming. Do we know what's going to happen? So if we are not anti-stigma at the moment, in the next generation, when we are old and gone, what's going to happen? What's going to happen? Train them in mental health awareness. Let people understand that this thing is not feces. There is not flies. They are human beings. We are human beings. So we have to understand that. Sometimes people understand, they just feel, No, not because, fine, I'm trained now. I know how it is. I have more insights, the knowledge, everything, how to care for them. So that's why we are doing this show, to enlighten people. That's why we are doing it. So it's so important. Create peer lead groups for connection and shared experiences, and build crisis alternatives so people aren't pushed into hospitals. Because when patients stays in hospital, they become institutionalized. It's difficult for them to start mingling. Different for them to start. They are free to have relationship. They are free to marry. They are free to do everything. Just like me and you, they are free to live a good life. If there's any risk, if they need to be looked after, do you know how many people are taking medications? A lot in every part of the world. They are taking it for one mental health illness or the other. A lot. So, but because people integrated them, supported them, you wouldn't know. So that's what we should be doing. Because I want them to just rest and not to do anything. Okay? I will train my children even. Yes, enlighten them. Tell them. Just like everybody is saying now, say, train your children about money. It's the big thing, just like mental health. Train children about money. If you start training your children about money, when you hear the word, it is not how much you earn, but how you use money. It's the same thing like mental health. Make people believe this is it. We all have mental health. That's the last one we treated before this. Mental health and mental illness. Thank you for that. Please like. Please like. Thank you. So measure outcome, belonging, stability, employment, and well-being. If yes, so it's very important. Any question? Any question? Thank you, NS Praise, for joining. Thank you, Pure Gospel. Thank you, Ivan, for joining. Thank you, Chukwu Emeka NS. Thank you for joining. So on this show, when we started earlier on is it February or March, something like that, we had a welfare package going on because one of the reasons for setting up this platform is for your support and for my support, for enlightenment. Is a place where we support each other emotionally, psychologically, in the aspect of welfare as well. So we had a package running, and we have 4 people who have won the package. So the first person is Pure Gospel. Second person is NS Praise. The third person is Ikechukwu. Fourth is Miracle. So these 4 people and other people, other subscribers, they have been supporting this channel so much. The channel is just almost 3 months old now, and I think they have been doing great work. Other people like Joshua, so many of them, they have been supporting the channel. Every show they've been there, the platforms they've been there, and so many other people. But these are the 4 winners. They are the 4 winners. So that's why we are supporting them with little welfare package for them to use for any little skills or businesses that they run. It's very little. Hopefully, as our platform continue to succeed, we're going to do more. That's what the platform is all about. So if you haven't watched my first video where I introduced this platform, I would like you to go and watch it again. And we are sticking to that. So that's why we are doing this today. So I just want us to applaud them, thank them so much for all their support. Thank you so much for all your support so far. So, and I want to say the big thank you, the brain behind all this. You see me here, I'm a nurse. I'm not a computer person. I'm not, I learned all these things you see me doing. I learned it. And the brain, the big brain behind it is Ivan. Ivan has been extremely support. He's so patient with me, if I may tell you, because I'm more of, my kind of job is more of do this, do that, do this. Yeah. So he's been so patient. He's been so hardworking. Sometimes I will just send him a text, do this for me, teach me this, do this and do that. So Ivan, thank you so much. So Ivan, thanks so much for all your support. Um, he's never tired to take my calls. He's never tired to do stuff. So thank you so much. We have other people. You are free to join the community. We're all here to support each other. So thank you so much. Thank you, thank you, thank you, thank you, thank you, thank you. So all this my love emoji is for all of you guys. Thank you for those that have not mentioned. Thank you for everything you guys have been doing. So we're going to send a message across to the people. You are free to suggest stuff that we'll be doing here that will help the channel to grow, that will help us to continue to push forward. So thank you so much. And I want to say thank you again. Any question? So we have a topic for next week. Our topic for next week is how to manage. I'm putting it in a way you will enjoy it if I frame it for you. How to handle, you said handle, so when we say manage, how to manage your care. So I'm going to look for another word for you. How to manage a patient who are presenting with aggression and violence. That's my field, you know. That's my main field. That's my specialty. That's my specialty, yeah. So I can come here and give you and tell you in the next 100 hours because it's my specialty. So everybody has their specialty in mental health. So that's my specialty. So thank you so much, everybody. Thank you. Thank you. Any question? We have 2 minutes before we finish up because I want us to close early today. Yeah, Ivan, thank you. Chukwuka, Ernest, thank you so much. Thank you for joining today. You will enjoy. We are just starting. So thank you so much. Pure Gospel, someone said that they don't need is okay, that we've passed that. So thank you so much. Thank you, Ernest Praise. Thank you, Miracle. Thank you. And bye-bye. Thank you. Bye, bye, bye.